You're sitting in the classroom and using. I'm gonna send you just a couple of slides here. Okay.
Can you hear me?
Yep, I can. How you doing, man?
Look, bro, how you doing?
Hanging in there. How you doing?
Yeah, I'm good.
Great, great.
So you ready to go shoot some one-on-one or what?
Man,
Yeah, too soon?
too soon, too soon.
They is Sweden today, right?
Yeah, it's such a made up holiday. My husband and I are super romantic. It's just a reason for retailers to get you to spend money. Don't you agree, gentlemen?
That's good.
It's not a real.
Well, it's
It's a
like
made-up
a
holiday.
Midwestern holiday.
Is it?
So far, yeah.
Yeah.
Other states, they have no idea about it.
Stage capitalism. Let me get
There you go.
Say something, Jeff.
Yep, I'm here.
Hello, hi, come on in.
Yes.
This is where it is.
What's up, man? Man, nothing to it.
Hello, sir. How are you?
I'm great, young lady. How are you?
Come right up here to the front. As you can see here, it's very intimate space. Most people tune in on the live anyway.
Okay.
And you do have the email?
I'm looking at it right now.
Thank you for coming out.
Right, I told you I was. You promised me lunch, so.
Guess what? It's some good eating today.
Uh-oh.
I don't know what happened, but instead of the chicken wing, it's the whole chicken.
Uh-oh.
Yeah, looks
It's
delicious.
breast, thighs, hips.
Uh-oh. You so silly, you said hips.
All parts are good.
I don't think I ever went in a store and said, deep fried hip. That is hilarious.
That's some steroid chicken.
That is hilarious.
You're making it sound really attractive.
Okay, what's your email?
Saginaw Cat 989 at Gmail.
Right, there you go.
Jeff, can you hear well?
Yes.
How's it?
My big brother Chucky. How you doing, man?
I'm doing good, bro. How are you?
I'm hanging in there.
Yeah. What's up with all this slip and falling, man?
Man, I wish I could say it was a slip and fall. It wasn't even that.
I know how.
Yeah.
Okay, good.
Hey, I ain't want to say that out loud.
Once you got it.
Are we doing the?
I see Jared over there. Jared, how you doing?
Good. Thanks again.
Great to have you.
There we go. Yeah, those two right there.
This one?
Yeah.
And this one?
Yeah. And the top, the one above it if you want. And I'll show the. That's next to fentanyl.
What I didn't know is now 10 out of 10 pills, out of 10 Percocets, 6 of them are laced with fentanyl.
This is the first.
Yeah, great.
All right. Can everyone see that?
Yeah.
Jeff, can you see? Candice, can you see the screen? Let me screen share.
Yes, thank you.
So did you were able to see, as you can see, I'm not a technical person. Were you all able to see my screen with the slide?
Give a thumbs up if you could see it.
I
Like
could
if
see
you
it
were-
on the TV screen. Yeah.
Yeah, I can see it on the monitor behind you guys.
Is there a little thing down at the bottom that says share?
Yeah.
Okay. Should we get started?
Yeah.
All right, should we do introductions first?
Sure, sure. So thank you for coming to our cat talk, and this is dedicated to the epidemic of fentanyl and opiates. It is an invisible killer. It affects everybody. It doesn't care about race or creed. We have some great people here. Now let them introduce themselves. I'm Naisha. I am the treasurer for the CAP. And Jeff and Candy, since you are on Zoom, would you mind introducing yourself as well?
Sure. Great to be here today. Thank you for the panel for being here today as well. My name is Jeff Bulls. I am the president of Saginaw CAP. We just want to, again, thank our panel and our people that are watching out in Facebook land. Thank you all for coming on and joining us for another edition of CAP Talk. This one is really, really special to us. And I hope you'll get a lot of great information today, and I hope you enjoy.
Hi, everybody. Good afternoon. My name is Candace Whitfield. I am the Prevention Program Coordinator for Mental Health and Substance Use Initiatives at the Greater Flint Health Coalition. However, I am born and raised and currently living in Saginaw, so I am really excited to be here and to have this conversation.
Oh, I'm Antonio Brooks. I'm a long life resident of Saginaw, Michigan. I work for an organization called F.A.N, Families Against Narcotics, and we're just here to help with any input we can. Thanks for having us.
I'm Lori Zolkowski. I'm Antonio's colleague. I live in neighboring Bay County, but I've worked in Saginaw County for a lot of my career. I am a mom of a daughter who struggled with IV heroin use for 4.5 years. She had a non-fatal overdose when she was 18 years old. She had just finished her first year at Delta College. We didn't know she was struggling with heroin use. And we wrestled with that for 4.5 years. She's 7.5 years in recovery now. And we started our local F.A.N chapter coming up on 6 years ago. So, and that covers Bay, Saginaw, and Midland. So we could help stop the opioid epidemic and provide information, resources, and support for people who are struggling with this. And so we're just here to help families when they're in the midst of it, but more importantly, to help prevent this from happening. There's an epidemic with vaping THC with our young people or using marijuana, very highly potent THC marijuana. And that was kind of my daughter's pathway into addiction. And so we just want to make sure we're protecting our kids. And if somebody is sick with this disease, that we get them the help that they need.
All right, I'm Jared Volahansky. I'm with the Michigan Department of Health and Human Services. I work for the state's chief medical executive and lead our state's opioid strategy. I really want to be able to share all the resources that the state of Michigan is working on to address the overdose epidemic in the state. So really glad to be here today.
Awesome. Thank you so much. Wow. Just doing some research on this while we were preparing for this CAP talk. Just looking at some of this stuff has been honestly overwhelming. But just looking at I'm looking at the opportunity to be able to talk to the community about this and to get the word out about this, because it's even what's on my screen right now is so stark. And so I'm looking forward to you guys sharing information and hopefully it'll help somebody out there. I know it will. So without further ado, Lori, if you wanted to take over and we can get started.
All right, so I brought a few slides that I shared in my presentation. I can come out and do presentations anywhere to anybody who will listen to me, anywhere from an hour to 4 hours. And there's a lot of information that I've learned over the last 10 years since my daughter overdosed. I'm not an expert in this field. I just retired from Delta College. I was a business professor. So I know marketing, management, and sales. I did not know, well, I was a pharmaceutical sales rep for 10 years, so I knew a little bit about substances. But some of the slides that I shared will really help you understand why we got to this place. We are in a very unique time in our history where we are seeing unprecedented deaths, so much so that our life expectancy in the US has actually declined for the first time in decades because we're losing so many people to drug overdoses. So the first thing on the slide is kind of the 3 waves of how this happened. So in 1999, you started to see overdose deaths from prescription medications. That's when companies like Purdue Pharma were starting to manufacture things like Oxycontin. Johnson & Johnson was manufacturing fentanyl. And I have to believe with the best intentions that they were for folks with chronic pain or I'm sorry, but maybe end-stage cancer pain or chronic pain. And then those pharmaceutical companies started increasing the doses, and really kind of letting anybody who had any pain use those medications. So we had a wave of overdose deaths from pills. And then, and Antonio, can you tell me where that curve is for the second wave, what year it was? I think 2003, maybe. You start to see overdose deaths from heroin.
I think so.
Okay, 2003, it's the purple line, I think. I can't see this.
Yeah.
Oh, let me look behind me here. Here we go.
Yeah.
Let's see. Yeah, heroin overdoses in 2010 started going up because what would happen is that so the way that narcotics works is that they addict you. That's the mechanism of action. They hijack your brain. So they take away physical pain. They also take away emotional pain. And if you take them long enough, your brain starts growing more receptor sites for them. And so then we started seeing people transition from getting prescriptions from their doctor for pills to transitioning to street heroin. There is no more heroin on the streets anymore. When we bring people in for treatment and we do urine and blood screens, it is fentanyl, and fentanyl is what's killing people. So in 2013, this is when the fentanyl deaths started increasing. Our daughter had that non-fatal overdose in 2013. They didn't test for fentanyl. The hospitals still don't test for fentanyl because it has to go through this CLIA test to be able to be approved. So we're still not testing for fentanyl in the hospitals, which is a huge issue. And our daughter overdosed then, and it was probably fentanyl. So that's why we're seeing this unprecedented amount of deaths. And I'm going to have you click to that next slide there and show you why this is so lethal. So on the left is a lethal dose of heroin. On the right is a lethal dose of fentanyl. And to give you some comparison, look at that penny and those few little grains there, that much fentanyl can kill you. So what we're seeing is not only are people who are using what they thought was heroin getting fentanyl, so they've kind of backed off the amount that they're using, but what we're seeing now is that methamphetamine, cocaine, and even pressed pills like Xanax and Percocet that are fake, that people are manufacturing, also have fentanyl in them. A couple of months ago, we had about 25 non-fatal overdoses in Battle Creek. And then we had, I think there were 6 or 8 fatal overdoses that same day. And those people were using what they thought was cocaine. And so there is no safe supply out there, no matter what you're using. Almost everything we see is being laced with fentanyl. All right, next slide. So these are Bay County overdose deaths from 2021. Your Saginaw County coroner does not report overdose deaths. Every county gets to decide if they do or not. We wish that they would because it's important to be transparent. But what we know about emergency responder visits and Narcan usage with Bay, Saginaw, and Midland, we're the Great Lakes Bay region. Midland has the least, Bay City has the second, and then Saginaw has the most. So I would be fairly safe to say that Saginaw has had more overdose deaths. Also, you guys are on the I-75 corridor. So when the drugs come from Detroit, up 75 to Flint, to Saginaw, and then further up 75, a lot of people in this area come to Saginaw to purchase their drugs, and sometimes they use them where they purchase them, and so you would see more overdoses here. When I talked to EMS, this was a couple of years ago, they were going out on about the same number of runs for overdoses, but they were using twice as much Narcan because the drug supply is so potent out there. So these are the drug-related deaths from Bay County. There were 42 of them, and 38 of them included some form of fentanyl. Is that right? Let me look at it. total opioid deaths were 38, 33 of them included total fentanyl. Most of the others included fentanyl plus something else, and believe it or not, there was one death from kratom. Kratom is a product that you can legally buy at a smoke shop. It works on the receptor sites, just like opioids do, and you can die if you take too much of it. So it's kind of positioned as an over-the-counter method if you want to stop using. Some people use it to try to taper off of what they're using, but it is very dangerous. There's been some legislation that we've tried to get passed to make that scheduled, and it's still not. You can go in any vape shop and get it. And again, my biggest concern is we as a society are terrible at keeping substances out of the hands of our kids. You know, most people get their first drink out of their garage refrigerator. If you're fancy, you got a liquor cabinet, and everybody I talk to knows you steal the vodka. And you know why you steal the vodka? Because you can fill it up with water. Everybody knows that. You ask any teenager, we all know that, right? So we're terrible at keeping alcohol out of the hands of kids. We're terrible at keeping cigarettes and vapes out of the hands of kids. And now we can provide 12 trees and a gallon bag of dried weed and vapes and dabs and gummies and edibles. And we're not locking it up, and your kids are curious and your kids are going to use it. And we're starting to see that in the high schools. And we are creating a really big storm that's about to hit in 5 years, where we have a huge population of young people who are vaping THC. We're seeing it. The school resource officers are talking about it. We have to hold those cannabis retailers accountable. I live in Bay County. You can stand on the corner of Euclid and Wilder at the Tim Hortons, and you can see 15 vape shop or 15 cannabis shops there. And so, yes, you have to be an adult to go in and buy it, but those adults can also sell it to kids. They're doing mailbox drops. They're driving by, getting paid on a cash app, throwing it in the yard. They're making drug deals at the school bus stops before kids get to school. Our kids are living in a world where we have never seen the risks that they're involved in. So it's real, and it's in everybody's neighborhood. Doesn't matter what you look like or where you live. You guys want to chime in?
Yeah, well, that was a lot,
It's a lot. It is a lot.
but yeah, that stuff hits home because I have a 15-year-old daughter, and unfortunately, I worry about that because her friends, some of them had those little weed pens, and they at school walking around puffing. Like, man, we was high. You know what I'm saying? We wasn't trying to be in front of no adult. They don't care. They just puffing them, and I'm like, man, they don't even know what they put in their gum. There's no awareness. They don't care. But like you said, we should have something in schools to where we can have people that can educate those kids on the dangers of those things. And if they get caught with it, they need some type of treatment for them. I don't care, teenagers or not. It should be mandated.
I think one of the points that, as you talk about the history of the opioid epidemic, one of the things that we're really seeing, and I just always really got to stress this point, is any type of street drug, you have to assume there's fentanyl in it.
You have to.
And that's really has been, likely one part of what has driven some of the spike in overdose the last few years is people using cocaine, methamphetamine, any type of, and then again, now the press pills, us, not assuming like that, why would I need to have naloxone when I'm not using an opioid? Well, there's, you assume there's fentanyl in anything. So really, anyone who is using, certainly we are focused on prevention. However, we just know that people do use drugs, and if that is, you're using any type of drug that you bought off the street that have naloxone available. That's really the message that we've really been pushing is as ensuring that everyone, again, it's about prevention, but for people that are using drugs, to make sure that we are promoting harm reduction. So
I think it's important to understand that people say overdose. Like I said, it takes 2 milligrams to be a fatal dose of fentanyl. That's like on that slide, little like grains of salt. People saying they overdoses, but they really getting poison. That's poison because they got the pill presses. And like I said, you can put 10 Percocets on the table, and 6 out of those 10 aren't really Percocet. It's fentanyl, lethal dosages. So you could take one and you could literally die. I mean, I think that's important because we say overdose. Overdose is an overusage of a drug. That's almost like killing someone.
So I have a question. what is the history behind fentanyl? Because it's not like meth where, you know, you can buy over the counter and some like chemist or home chemist comes up with it. Like, what's the history of fentanyl? Because I think that a lot of times we don't factor that in.
So fentanyl was manufactured, first of all, with a patch for folks who were in end-stage cancer who have severe pain. So I believe that the original intent was very honorable, that pharmaceutical companies, Johnson & Johnson manufactures fentanyl, the Duragesic patch, and there are others. So I believe that the intent was honorable at first. But people who are seeking substances, then look at, hey, what's new, all right? So people started chewing fentanyl patches. They would open fentanyl patches up and use those. And what happened with our drug supply? So once we legalize marijuana, it's not federal yet, but you know, our supply of marijuana, it's homegrown now. We don't have to get it from Mexico anymore. So we have DEA footage of the fields that used to grow marijuana. They've transitioned those into poppies. And so they can manufacture narcotics, opioids with those poppies. China and Mexico are manufacturing synthetic opioids now, which is fentanyl. And it's just switched and it's progressed. And now there are other things like xylazine. So the half-life of fentanyl, the high of fentanyl is very quick. And so if you're using, you want to extend that. And I want to be very clear here. So some people use a substance to feel good, right? Like you might go out tonight, Saturday night, and it's Halloween. You might get dressed up and have a couple drinks with your friends. So that's to help you feel good. Some people use substances to feel better. If you have social anxiety and now you got to go to a party, a couple drinks might help you feel a little better about that situation. I know people like that. When people are struggling with the disease of addiction, substances make them feel normal. So our daughter was shooting up heroin 10 times a day, just not to get sick, just not to go into withdrawals. So when people are seeking that, they're not using it to be like, oh, this is a really great time. Nobody in active addiction is having a great time whatsoever. So xylazine is an animal tranquilizer. It's called Train. And now they're mixing that in with fentanyl because it extends the effects of fentanyl. And so you're probably thinking like, well, who would do that? I want you to understand that addiction is really chemically induced mental illness. People do things that they would never do in their real life when their brains are hijacked. They will do illegal criminal things. They will do things that hurt their friends and family. They will steal medications from their family members. They will injure themselves. They will injure their pets. They will injure people in their care. They will do things that you would never do in your regular life because it overtakes your brain that this is the number one thing I need to do to survive today is to get this drug. And so fentanyl was developed for end-stage cancer pain, and then it became, you know, into the mainstream, and now it's being manufactured and brought in mostly by China and Mexico.
So speaking of xylazine, so like some of those symptoms, right? I heard people have like flesh-eating disease symptoms, limbs falling off, like your fingers and stuff like that fall off, and people don't know that that's the symptoms of xylazine. I mean, it's not, at the end of the day, it's not worth it. So what avenues would you suggest a person take that's struggling with fentanyl addiction?
Well, there are many ways.
Interject for one moment. I'm sorry. Is that me?
Yeah, go ahead.
Okay, sorry. Yeah, I just wanted to interject. So, within my role, xylazine is something, and I just want to clarify this just for clarification. I know that when we see those pictures of the xylazine wounds and we get that narrative of their flesh eating, those wounds are actually healable with the proper care and treatment. So I just want to be careful about how we talk about these different consequences that can come with using these drugs. Xylazine is an animal tranquilizer and it is a sedative, so it extends the life of the fentanyl use. So I want to just be sure, like while we're here on that subject, to kind of put in some harm reduction and prevention tips for the overdose portion of that. So one thing, there are testing strips that can be used for fentanyl and for xylazine to test the drug supply. So sorry, I'm just kind of cutting in, but I want to make sure that we get those things out right now in the forefront. So it is scary and we do want to prevent people from using, but people are going to use. That's just the honest truth about what it is in this world. So making sure that they have those harm reduction tools like the xylazine test strips, like the fentanyl test strips, which in Saginaw, you do have access to those. It is very limited, but room 202 at the health department does offer harm reduction materials, even as far as a safe needle exchange program. If you have questions about that, I can give you more information about that as well. But also for the xylazine wounds, I will say those are healable. You can, when people start to develop those wounds, they do come whether you are an IV drug user, whether you are taking these or through the nostrils or through any other means, you can still develop these wounds. So that's something important to know. But with any other wound, if you keep them wrapped and you keep them moisturized, usually with Vaseline, there is a a wound clinic in Genesee County that puts out material and literature. And there's also a nice handout that I got from University of Pittsburgh, I believe, that tells people how to take care of their wounds at home. So I don't want to say that it's flesh eating, because it can deteriorate the flesh and it can cause amputation to be needed. Your bones are not just going to fall off. It's going to take some time if it goes untreated, but it all is preventable. So I just wanted to put that out there. I can find some links to those things and send it over to the CAP team to disseminate after this, if that is helpful. But I just wanted to put that out there because I know xylazine is very scary to look at, especially when you see the end stage of a wound. But I just wanted to put it out there that there are ways to, restore the health of one's skin or those wounds. So it's not an end all be all once you get a wound from taking xylazine. Also, I do want to stress the importance of always having Narcan or naloxone handy, even when you may suspect that it's they're cutting their drugs with xylazine or whatever the case may be, because Narcan may not reduce or retract what the xylazine does, but it will retract what the fentanyl is doing. So they may not have the same comeback effect as they would when they're coming back from a fentanyl overdose, but it will help restore their breathing. And also that is my job, Narcan training and more on the harm reduction and prevention side. So I always just want to make sure that people know that there are options and there are tools and mechanisms to reduce harm if, cold turkey quitting or recovery or treatment is not, if that person is not ready for that yet.
Those are all really good points to make. That is something I've often seen in the media that is, the narrative is naloxone doesn't work on xylazine. No, because it's not an opioid. But 100% of the xylazine that we're seeing in the state is mixed with fentanyl. So it is important to know that that you should be using naloxone at any time that there is an overdose suspected. It's something where again, like that will be able to reverse the opioid impact, even if, as mentioned, the xylazine people don't come out of the overdose the same way with the effects of the xylazine. But the other thing about and also that's a really good point, and it's really important that we really are promoting the overall, harm reduction is really important because it's able to help connect people using drugs to care. Because again, it's not just those organizations, not just, provide sterile syringes, which we want to prevent hepatitis C, HIV, which, the hepatitis C over the last decade has really increased in the state due to young injection drug users. But they connect people to treatment, like the actual treatment for their addiction, but also for all these other health conditions that people using drugs may have. So,
we can't help restore somebody's life until first of all we save it. So if someone is going to be in active use, and I'll tell you, sometimes there's a wait time to get people into treatment. Somebody might want to quit today, and it's Saturday. There's no treatment facility that's going to answer their phone except for one. And to get admitted there is going to be a challenge. If you have Medicare, there's only a couple of treatment facilities you're eligible to go to. Other facilities only take Medicaid. Others only take private insurance. We just had a situation where a gentleman, we got him to treatment. They tested him and he was diabetic. Yeah, so they said you can't stay here. So we worked very diligently with Dr. Matt Dybel, who's at Covenant, has been a huge advocate for us. I reached out to him. He's actually not even in town, but he connected us with a physician there. We got this gentleman to Covenant Hospital. They dosed him on Suboxone and gave him a few days prescription, so he didn't have to use street stuff. So we could have some time to get him into treatment. They provided his prescription for his diabetes medication and his mental health medication, because you have to have that in place before you go to treatment. So there's a lot of barriers that people face, but the first thing we have to do is prevent them from dying. So we provide a lot of resources. One of them are fentanyl test strips. And on the fentanyl test strips, one of the things we list is a never use alone phone number. It's not a F.A.N number, it's a national number. Most people who die are by themselves. I've lost several people very close to me who died while using alone. You call this number, tell them your address, you use, they stay on the phone with you. If you become non-responsive, they will send an emergency responder vehicle there. So the number for that is 800-484-3731. 800-484-3731. We want to make sure people aren't dying. And then we provide fentanyl test strips with the directions on how to use it. You don't have to waste any of your the substance that you're using, you just test the residue. So if you had some pills in a baggie, it tells you how much water to put in there, shake it around. And this is just like a little dipstick, a urine dipstick. That's actually what it's for. It's a urine drug screen, and you can test your supply. So if people are still using, we want to keep them safe. We put newspaper Narcan boxes out in Bay County. We're getting some in Saginaw County. We put wound care kits in there. So to that point of taking care of your wounds, a lot of times people are afraid to go to the emergency department because they've been treated so poorly. We are actively educating our emergency department physicians. I just did a presentation to the internal medicine students at CMU Medicine. The MSU medical students go out with our harm reduction team down in Detroit. We are training at the police academies. We're training new police officers. We're training new doctors. How not to stigmatize people with this particular disease and to let them know it's not an option not to treat them and care for them. You don't get that choice. These people are sick and you're taking an oath to help people. But there's some catching up to do with doctors' attitudes. So a lot of people don't want to go to the emergency department because they're so stigmatized there. We're working on that. And the emergency departments that work with us to just carry that baton for that little bit to get us some time to get that person into treatment and treat them with dignity and respect, that has to happen at every single hospital location. We provide Narcan. Anybody who wants Narcan, it's available for free. You can just reach out to us at Families Against Narcotics. If you want it for your business, anywhere the public gathers should have Narcan available. Every single business, every single organization, just like you have fire alarms and fire extinguishers and AEDs, you teach people CPR, everybody should be prepared because you don't know when somebody might overdose. So we are big proponents of that. We're big proponents of safe syringe programs. I'm so thankful Saginaw has one, room 202. We put that information in our resource envelope. We wish that Bay City would get one. We're hopefully going to be working on that because we have to keep people safe. And not only do they die of hepatitis C or HIV, but people get terrible wound abscesses and can die of heart valve infections or because of their wounds. And they're afraid to go to the hospital.
Okay. I want to ask something. Is that you, Naisha? Go ahead.
He probably was gonna say the same thing. You talk to him.
Okay. I wanted to address, what we do at Saginaw Cap. We do a lot of political advocacy, and we kind of focus on policy. We focus on solutions. When I look at this, fentanyl isn't necessarily a street drug, from what I understand. So, if we're having this conversation and we're going to the root, a lot of this is these people are getting these substances from a pharmacy, unless I'm misunderstanding it.
Started that way, but now is coming in illegally.
Okay.
Street drug now.
So so it's both, right? It's still being, people can still get them, prescribed.
It's rare because thankfully, talk about legislation in 2018, our government stepped in and said, you can no longer prescribe 30, 60, 90, 120 pills for people. There's also a program called MAPS. So in Michigan, if you're going to prescribe somebody a narcotic, you have to look at their MAPS profile, and it's going to show you every single doctor that they've received a prescription from, no matter what kind. It could be your dentist, it could be a family practice, could be an emergency department. We weren't tracking that before. So people could go to multiple physicians and get a lot of product. That doesn't happen anymore, or at least it shouldn't happen anymore. So the government, because of policy change, said you can no longer write like that, physicians, because we're killing people. If you've ever watched there's one video or one series I've watched around this, and it's called Dope Sick. It's on Hulu. And it's about how Purdue Pharma systematically targeted small blue collar communities like ours, who people do physical labor and have more physical pain, and especially mining communities. They targeted those communities for people, and they up the dose and up the dose and up the dose. And I'm of the believer, I call them physicians for 10 years. Most of them are very honorable people, but they were not told about the addictive properties. In fact, they were encouraged to treat people's pain. You know, the pain scale, the happy, sad face scale, that was pain is the 5th vital sign. It's the only vital sign that is subjective. All the others, like your blood pressure and your weight and your temperature, those are all factual things. That pain scale is subjective. And so physicians, if they've got a bad rating for not treating their patient's pain, would get reimbursed less money. Nobody wants to make less money. And so we encouraged physicians to treat pain. And the pharmaceutical companies at that point, I believe, were not being ethical in what they were doing. There were some physicians who caught on and had lines up of people who the drugs had addicted them, and they were just writing prescriptions all day long. Not the majority of doctors, but some. And so because of the love of money, that's why we're in this fat mess right now. So I encourage you to watch that series. It was really eye-opening to me. The kind of the background of this. And I'm gonna have you, Naisha, can you pull up the slide that's got the Michigan map on there? I think we'll show that at some point.
I wanted to touch on something. And that was the fact that we went to jail for crack.
Yes.
So let me tell you, so while I think all of this is wonderful and great, I'm also cringing because I know how many homes were destroyed because of the war on drugs. But now we go from a war on drugs to an epidemic. It's like a slap in the face.
It sure is.
Especially if you grew up during that era when you were getting, what was it, maximum, minimum?
The sentencing.
The sentencing. We were predators.
Yeah.
And that's including, our current president was also calling us super predators. And we go from being super predators to now he's sponsoring to make sure people are getting the help. And I think that's wonderful because I have people in my family that, of course, have issues with this. But it's still that niggling feeling that just that feeling, and it's I can't really put words to it besides it just feels like a slap.
I understand.
Yeah, I understand as well. And we talked a little bit about before this, so the only way that I can explain it, as not a person of color, is I didn't recognize this as a problem until it was in my house. So once my daughter overdosed, it was on my radar. I'm a breast cancer survivor of 6.5 years. I'm an advocate for people to get mammograms and an advocate of breast cancer prevention because it affected me. I don't have anybody, thankfully, in my family who struggles with autism. Autism's not on my radar. I don't put any effort there because we only have 24 hours in a day. We all got to get up and take care of our own lives. And so any advocacy that we do generally happens when it affects me. Selfish, 100%. Do I feel some guilt over that? 100%. But I can't go back and change that narrative, but I certainly can help every single mom, no matter what that mom looks like, and no matter what that kid looks like, I can help moving forward. And I 100% agree. We talk about racism. So it's a criminal activity in this neighborhood, but now, oh, these poor kids over here, it's not okay. It's the wrong narrative, and we have to fix it. I'll tell you, we're actively fixing it, both legislatively and in law enforcement. So we have a program called Hope Not Handcuffs. And we have helped over 10,000 people in the state of Michigan with this program. We partner with local police departments, which sounds preposterous, right? When my daughter called us and said, I owe a drug dealer money and I don't have any money, will you go get some out of the ATM and come and get me? When she lived 3 counties away. First thought is call the police. I wasn't going to call the police. I was afraid of the police. I was afraid of the drug dealer. I was afraid people were going to find out this was in my house. I didn't tell anybody. I was so ashamed. So of course we didn't call the police. Well, now you can walk into the Saginaw City Police Department and say, I'm struggling with addiction. Will you please help me? They're not going to ask for your ID. They don't ask for your name. All they do is call us and we send a community volunteer trained angel. And we sit there. Any addiction. Yeah, any substance. So we don't do anything with behavioral addictions like gambling or sex addictions. Substance. It doesn't matter if it's alcohol. It doesn't matter if it's crack. It doesn't matter. So Families Against Narcotics was started by a group of people in 2008 when there were several young people died of heroin. And so it was just community members, right? They weren't marketers, they didn't brand it. So just because it's Families Against Narcotics, that's really not what it is. We're really Families Against Substance Use Disorder. So we will help anybody. When you walk into that police department, they'll call us. We'll send an angel over there. We'll sit down with you. We'll do an intake and we'll find you a bed in the treatment. We will get you food if there's a wait time. We'll provide you with Narcan and fentanyl stress strips. We'll sign you up with a peer coach. We will foster your cat. We'll take you to treatment for free. We'll give you free transportation. We will provide help to your family members with Stronger Together meetings and a family coach. Something that I wish we would have had. When our daughter left the hospital, we got nothing. Not a pamphlet, not a flyer, nothing. We didn't know what to do. So now these programs exist because we created them. And, you know, there is still a stigma with police, with folks who are using. There is still a stigma with folks who are using and the police. But I'm telling you, we're working so hard to change that. We're training the young officers and we go in and we regularly, in fact, Antonio came in and spoke to the young police academy officers at Delta with me. And I bring in people all the time to do that, talk with me. And more than ever, people came up afterwards and said the talk that he had was so impactful because he did talk about the stigma of police, especially in the Black community. He was super honest about that. We had a great discussion. We have to bring it out into the light and talk about it because if we don't, we can't fix it. But I 100% agree. It's a tragedy.
Yeah, thank you so much for that. Which that leads to implicit bias. Because not only, I think not only do police have to be trained on that, I think we have to go into the medical system as well. I'll say this just on a personal note. The reason I'm not there today in person, I had an injury to my leg. And so I had to go to the ER. And, you know, they did prescribe me an opioid, but it came almost with a lecture. Like it came with a lecture. But I say, you know, I've seen others of a different persuasion that don't get that lecture. And
Everybody gets a picture and a box of Narcan.
But
Every single
everybody-
person.
I don't think that, because my daughter was hit by a drunk driver. She was in a coma. She was in a wheelchair. She had to learn to walk again. She broke everything from subdural hematoma to many limbs, even her toes. I took her to her first orthopedic appointment where she was basically like on the cartoons in the wheelchair, you know, like the
Full body.
Yeah, all yes.
stuff like that. But that was the first thing that the doctor said. He was trying to lecture a person that just got out of the hospital out of a coma.
Mhm.
And that is a trigger for a young Black woman.
Mhm.
That's not that there's no empathy there. As a physician, you're lecturing it's a place and time for everything, but it's always a place and time when we're Black. We have the face of addiction when we're not the ones that are addicted to pills,
Mhm.
but we'll still get treated this way. So I'm saying all that to say, what can we do to change a culture of not just, and I see you, Jared, and I want you to chime in, and Candace, is Candace there too? She's been quiet. How can we change that culture legislatively and just in a community sense?
So I'll start with the state of Michigan has established requirements for any medical licensed professions to have taken implicit bias training. That's a new requirement that has gone into effect. I think it went into effect about 2 years ago. That has to be done for a health professional renews their licensing.
Implicit bias training. Could
yeah.
you expand on that a little bit?
Yeah, I don't know. I'm not a medical professional, so I haven't actually done the actual training itself in terms of what all it covers. And actually was developed by the Michigan Department of Licensing and Regulatory Affairs, not the Department of Health and Human Services. So I don't know enough of the details about that to Other than I think it's something that's been really needed, and is something that we are we're encouraging again, but also the things that like MDHHS has done in terms of helping support hospitals in terms of understanding. You mentioned what's going on at a local hospital in terms of being able to provide a basically a short-term a bridge prescription of Suboxone after to connect somebody to treatment. That's something we really have focused on too. And it's part, and that culture of understanding addiction is part of what we're doing with working with different community partners to train hospitals. We have about half the hospitals in the state that have been participating in that program to be able to have that after a non-fatal overdose to connect somebody to provide that bridge prescription of Suboxone and then work to connect them to care, which previously after a non-fatal overdose, people were just released and in withdrawal. So be able to better connect them to care has been a big priority for the state health department.
Okay. I wanted to, before we move on, I got Candace with her hand up, and then I have something in the chat as well.
Yeah, I just wanted to put that out there that if anyone on this call who works in this space, whether at the health department, anywhere in the healthcare field, especially dealing with this, I highly encourage you to take implicit bias training. I will say I'm a little disheartened that you weren't able to talk a little bit more about what that training entails, but it's basically addressing what the concern was just voiced. There is historically in the medical field, there has always been this idea that people of color, primarily Black people, and you especially see this in maternal and child health, that we don't feel pain, right? So anytime we get pain pills, they're not because we need pain, but it's because they all automatically label us as with the issue of being an addict. And so what that training does is kind of reverts or tries to go back and retrain the minds of these physicians and caretakers who have been trained within nursing practice, medical practice, physician assistant, all the above, to think that, Black people do not feel pain. This is historically when you see those, especially for maternal child health, they used to operate on women and slaves, no type of anesthesia or anything, because they wanted to see how we react. And so what these implicit bias training does, and it educates you on that one, but then also how that's a problem, because you see that in maternal child health, and you see that also in treatment. If you look at the data for people who get treatment for substance use, Black people, and I'm sorry to be so blunt, but Black people are less likely to get treatment for addiction than their white counterparts. And then even when they do get treatment, they're more likely to go back and start using again because of all the stigma attached with Black folks trying to get treatment and trying to get better, because none of these systems were set up for us to actually win. And that's just historically. So these implicit bias trainings are so that the people who are writing these laws, writing these policies, upholding these rules, and sitting at these tables can speak more clearly and fluently to those things, so that some communities are not continuously left behind. So that's what the implicit bias training is supposed to be for. It's supposed to be educational, to educate folks on what has happened before and how we got here and why it's necessary. And then also how it's harmful to communities, to the whole community at that. So that's what the implicit bias training is for. And again, I highly encourage anybody who is working with diverse populations, especially if you are not a member of that population, I highly encourage you, even if it's not offered by your employer, to you take, I can't find the word right now, but you take the liberty, or you do it yourself, because you're working with people, you're choosing to work with people. So I highly, highly, highly encourage you to take that training of some sort.
I just retired from Delta College and I taught marketing and management classes, and in my management class, I would have my students get online, and you can do this yourself too, Harvard Project Implicit. And they do research to find out what our subconscious biases are with different types of people. And I would have my students do weight. So they would show faces of thinner people and heavier people, and then positive words and negative words. Then I would have them do race, and I would have them do age. And it measures how quickly you can associate positive or negative with those different faces. And every single semester it would show that there is more negative bias to people who are overweight, a person of color, and old. So in our culture, regardless of who is taking that test, regardless of their age, their weight, or their race, our entire class, majority have positive feelings towards young, white, and thin, regardless. That is systemic. And so when you're looking at those implicit biases, they're not your biases that you know about. It's stuff that culturally that we change. And it goes across not just people of color, but it goes with me as well. You might look at me and be like, oh, she's some white, rich white girl. And I am now, but I grew up in Section 8 housing. I was on food stamps. I had food insecurity, housing insecurity, violence, and crime in my neighborhood. You wouldn't know that by looking at me. So implicit biases, when I look at you, I think I know who you are. And we're wrong a lot of the times. And in the medical community and in the law enforcement community, much of that is targeted to people of color, that we make assumptions about who you are as a human based upon what you look like. And it's not accurate.
Let's go
We
to,
can do better.
thank you, sorry about that. Let's go to, Imani has a question in the chat, and then, I want to know, Chuck, if you wanted to, jump in, or Rose, you guys want to jump in, you have been silent. Imani says in the chat,
Oh, I'm here. I can be on camera if y'all don't mind.
right.
Go
Okay.
ahead.
Hi. So I work at MEJC. I'm a youth organizer, and I just wanted to know if y'all already didn't touch on this. What are y'all seeing as far as opioids in schools, or bringing prescription medications into our middle schools, our high schools, and how is that affecting our kids?
So I just had the opportunity to be on a panel discussion in Midland, which is a neighboring community with school resource officers. And I just met yesterday with the probation office, youth probation officers and school resource officers in Bay. I've not had that same opportunity here in Saginaw, but what they're seeing is that kids are vaping to a huge extent and vaping THC in the schools. They're also confiscating some just straight up weed in the schools. The pills, they're not seeing opioids in the schools, but what a drug that is kind of under the radar right now is Adderall. So Adderall is the #1 abused prescription medication on the college campus. 2 years ago at Michigan State, there were postcards strewn around the dorm floors that said, if you want to study better and take Adderall, call this number. So Adderall is a huge issue with our young people. It was a part of the disease progression for my daughter. She'd party on the weekends, take Adderall on Sunday to study to keep her grades up, and then take a Vicodin on Monday to chill. So in that police academy that Antonio and I were just at, and I don't remember if we were there for the whole time, but 4 of the new recruits, when we were talking about Adderall, they said, yeah, when we were in high school, which wasn't, too long ago, guys would take a handful of Adderall before a football game just to get jacked up for football games. When I go out and speak with junior high, you understand.
Oh, I'm sorry. Go ahead.
I wouldn't be worried about narcotics necessarily in the schools, but I'd be definitely worried about vaping THC and about Adderall use.
Yeah, I mean, I'm asking as I'm just being a mouthpiece for some of the youth conversations I've had with some high schoolers who go to like the more affluent schools, and what they're saying is uh, 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 there's drug use that's getting swept under the rug because of the reputation of their school. They don't want to call it out, or these are the more affluent schools. These are the more what is it? More wealthier students, and a lot of their behavior, like I said, getting swept under the rug, or it's getting I don't want to say dumbed down, but it's getting to a lesser extent as being the same as bringing a vape, when instead they might have bought like you said, Adderall. That's really is running around in these high schools. And I just wanted to see from anybody, a parent or somebody on the panel, was anybody else hearing about these incidents? I know, like I said, I do work with high schoolers, so sometimes we do have a little more intimate conversations. I was just trying to see if that was something that anybody else saw that was affected, but definitely see a giant increase in vaping, even in the elementary schools, which is crazy to me. But yeah, that was my question. Thank you.
All right.
You said that you weren't able to get to, Saginaw schools yet. What's the timeline looking at, for going into Saginaw schools, and how can we, as CAP and concerned community members, how can we aid you in that? Because I know you're looking at my son, he's grown though. He's not a high school kid. I know he looks like one, but he's an adult. But I do have relationships. I have nieces, nephews, things of that nature. I have young family members who I know vape, and we are trying to do what we can do to get them to stop. But you know, it's very hard to have your hands on children all the time. And just what can we do as a community to assist you guys?
So I would say education, education, education. That is how we stop this. We will go into the schools when we're invited into the schools. So we've not been into the schools yet, except for Standish Sterling. It called and invited me, which was great. So when we get invited, we will go. These 2 meetings that we had were just kind of bubbled up and new. I've never met with school resource officers before. If there's an opportunity to do that in Saginaw, and I think it's great that they all get together to hear what's going on in their in individual schools, because across the community, there's, you know, economic diversity, there's racial diversity. What's going on in your school? What's going on in my school? We have to talk to each other more. But if we can get invited in, we will. One of the things that F.A.N is working on, they just hired an award-winning film producer and book writer, and they created a graphic novel for teens along with curriculum that addresses substance use. And so that will be rolling out hopefully the first part of next year. So we'll have a curriculum to bring into the schools. But the thing that I would really ask the schools to reconsider is what happens is when a kid gets caught vaping, they get suspended. That does no good. So we talk about evidence-based all the time. We're going to do evidence-based things. There's no evidence that suspending children changes behavior.
Not at all.
At all. It probably makes it worse. Why do we keep doing it? And we've asked those questions because we don't have people to sit in a room to sit there with them and do education. We'll come in and do it for free. I bet there's grandmas and grandpas that would come in and sit in a room if you need a person to sit in a room with kids. And I get that resources are scarce, but kicking kids out of school for vaping does not help. The other thing that changed legislatively, which just came up when we were talking with the probation officers, is back when I was a kid a million years ago, if you would get an MIP, you were kind of in trouble, right? Now it's just a ticket. You just get a ticket and you pay the ticket, which the intention is we don't want criminal records following our children. That's a good thing, but we should mandate education. We are not educating not only the kids on the dangers of vaping, but we are not educating the parents on the dangers of their children vaping. So that young brain, their frontal lobe, which means if I do this, this is going to happen. That's not developed until you're in your mid-20s. That's why we do really dumb stuff when we're teenagers. I jumped out a 2nd-story window to go see a boy when I was a teenager. What was I thinking? I would not jump out of a window for any boy, even if it was not the 1st story now. But teenagers aren't thinking straight. Their brains aren't developed. So when you introduce a substance to their brain, it hijacks that part. So they are not progressing into their, thought process. So I think suspending kids for vaping is the wrong thing to do. I think giving a ticket and making a parent pay it, or not making, but a parent's going to pay it. How's the kid going to pay it, right?
Right.
We can do so much better. We have to educate. The other thing I would say, our cannabis shops should absolutely provide free lock boxes when they're selling cannabis. Provide a lock box, lock that stuff up, because your kids are going to be curious and try it. Your pets might get into it. And we have a lot of neighborhood prevention coalitions that get grants for free lock boxes. Let's partner and keep the substances out of the hands of our kids, but we're not doing it right. You cannot punish somebody out of substance use. I don't care if it's vaping or if it's narcotics use. You're not going to punish people out of it. You have to educate people out of it, and we can do better there.
Yeah. So one thing, you can't punish people out of it. So I hear parents that say, well, I might as well let them do it at home with me so he don't go out in the streets and do it. My mom, she wasn't buying that. I don't buy it. I'm not gonna do that myself, but do you think that is working in some households?
No, because you're exposing a young person's brain to a substance. And again, the intention might be good. When my daughter was growing up, we had other parents that say, I'm going to let my kids drink at my house so I can teach them how to drink responsibly. You're not going to teach an adolescent brain how to behave on a substance responsibly. You are setting them up to get their brain hijacked. If you start using a substance under the age of 21, you have a 1 in 4 chance of becoming addicted. 1 in 4. I take those odds to Vegas, right? If you wait until your mid-20s, those odds go up to 1 in 25. Because your frontal lobe is developed, the code is written, and you're less likely to get hijacked. But I will say, because of the potent substances that we have now, you could also get a knee replacement at 55, and still, those drugs could addict you. But a young person's brain, age of first use is a huge risk factor. Availability of drugs, huge risk factor. Genetics, I didn't know, we have alcoholism on both sides of our family. Genetics, the way that your brain is composed, can be a risk factor for you becoming addicted. So we got to do better in the schools. That whole vaping thing, especially THC, we are setting ourselves up for a terrible outcome, You know, kids, I just learned this yesterday when I was at that meeting. Kids aren't playing sports anymore. You know, the effect of COVID on the socialization of our children. They had a football game here at Saginaw High, and they had 32 kids on the roster. Only 14 showed up to play the homecoming game. That breaks my heart for our children. Why? Why aren't we having our kids engage in healthy activities? We have to do better for our kids. We just do.
It's amazing to me though that this is even getting into like jails and prisons. I mean, of course, I don't want to get there, but it's just. It's like, it's invisible and everywhere and loud inside.
It's a crisis. And we should address this just like the crisis of COVID. So oftentimes we're told, oh, we can't, or we don't have the money, or we don't have the time. And then thousands of people started dying of COVID. Surprisingly, we had the money and we had the time and we could. So don't tell me you can't, it's that you won't. And that's a difference. And we have to, as a community, push. We have to push our medical community for better treatment, our law enforcement for a change in beliefs and attitudes, our court systems for a belief and change in attitudes, our schools on how they deal with kids who are using and what more they can do to prevent it. We have, this battle is on so many fronts, and there's not enough of us soldiers. We have to recruit more people to be on this side and say, we got to do better.
So while you're bringing up resources, I think this is a good time to talk or to bring up what has been the latest development that not just in Michigan, but nationwide. With the various, we were beginning to see the first payments from the various settlements with various drug manufacturers, distributors. And just, I want to share just a little bit how it works. In Michigan, it's a 50-50 split generally between what the state share is that we're granting back out to the local communities, funding the naloxone that we are, being distributed by organizations like F.A.N across the state, and the harm reduction organizations, including from the Saginaw County Health Department. But also just note that all counties, so Saginaw County, and any city or township with a population of more than 10,000 is getting their own local settlements. So I would just encourage everyone to be engaged in conversations about how money is being spent in your community.
Yeah, connect with your local county and city legislators. It's going to be different for every single distribution of that money. I had the privilege of being in a room with Amy Belinsky, who is a colleague, who comes out and talks to communities on how to access those funds. It varies by community, and communities have some leeway in how they're going to spend those. We had a really impactful room full of people. A lot of people in the treatment prevention industry during that meeting in my county. But I was a little disheartened to hear commissioners talking about the 15% of the money that can be spent on whatever they want, like roads and bridges. That should not be the focus. And all there is money that can be spent wherever you want, not on something for opioid use. Why shouldn't it be? This is what it's there for. But the conversation quickly turned to what else could we do with the money? Or could we have more Viper units in our police to go arrest more people? Could we put a scanner in the jail? And Amy said those are not appropriate use of those funds. So when you talk about implicit bias, there it is. We have people who are in our government and in our police departments and in our jails thinking, well, give us more money so we can punish people more. It's not working. Show me evidence that it's working. Yeah. Yeah, and it's not working. It is getting worse. It's wrong. And we all have to stand up and say, no, that you can't do it that way. So.
That's the opioid settlement.
It's the opioid settlement funds, yeah, and so I'm a little concerned because we've seen with the ARPA funds, we had some communities where the commissioners gave themselves raises. Not okay. Not okay, and as community members, we need to be at those meetings and we need to know, and also there's no reporting back. So every grant that we've ever written, you gotta tell where every damn cent went. They're trying to make it easy for us to get this money and use it in the right way, but as soon as you make it easy, there are people who are gonna say, oh, let's use it over here. You have to keep your eye on that, because you gotta keep your eye on it, because it's not all gonna be used in the right way.
So how do you access the type of information that you're sharing? You know, like for regular everyday Joes that don't know about those meetings and about those type of funds, how do we access that?
Your local commissioners, you call your local commissioner's office, somebody will answer the phone and you say, I want to be involved when the discussions are happening with opioid settlement funds. How do I get invited to that? I invite myself to a lot of meetings. Because they're not gonna come knocking on my door. I invite myself to meetings.
And I'll say from the state perspective, like our share of it, we have a really comprehensive website that's about to launch. I want to say the exact date because I always don't have any more delays, but very soon, next few weeks, there'll be a very comprehensive website that goes through all of these, everything about the state, share how it's spent, decision making behind it. So.
For Michigan Association of Counties, that's another good website that you can get onto, but connect with your local legislators, especially the ones who represent you from your district. Have conversations with them and express not only your concerns, but also that you're gonna be keeping an eye on where that funding goes. And it needs to go to help prevent this from happening. And it needs to go to help people get treatment. There is such a lack of treatment, especially for our youth, getting young people into treatment. There's like 3 facilities in the state.
Well, these are per county.
Yes. And every county is doing it differently.
What are some of the alternatives to suspension for a student caught vaping?
Excellent question. What are some of the alternatives for a student caught vaping? Again, I'm not an educator. I did teach at the college level for 15 years. And if you're vaping, that's on you. You couldn't do it in the building on campus. So I would recommend education instead of kicking some kid out of school, which changes nothing and also doesn't share with them why we're concerned that you're doing this.
Right.
Okay, we're not telling them the why. We're not. So I would say those educational programs. So you either come in early, you stay late, or your lunch hour will feed you, but we're also going to sit and we're going to have some group discussion, an individual discussion to help educate you on why we're concerned that you're doing this, how it impacts your brain. Here's the thing, kids are smart. My daughter outsmarted us at every turn when she was using drugs. She knew all the apps to use. She knew how to get them. Like, your kids know more about drug culture than you do. They just do. We're officially old. Welcome to the club. And so kids are smart. So we created a presentation at Delta College. We do before COVID, and I think it's back up again. We do a Possible Dreams program where we bring in underprivileged, smart kids into Delta in the summer, and we teach them all sorts of different things, all sorts of different classes. And one of the things we implemented several years ago was a choose not to use program. For 1 hour, we had those kids in our class, and we taught them the decision-making process we go through when you choose to do something. And we ask them, like, why would you choose to use a substance? And they will tell you. We're curious. I see my parents do it. My friends are doing it. I'm getting peer pressured. Maybe I'm sad and it helps. I've heard that it helps you if you're sad, feel better. They'll tell you why they're doing it. And kids know why. And then we ask them, well, where do you get your information on drugs? Our friends online. And then we ask, is that reliable? No. They know it's not reliable. What would be some reliable information? My teacher, my pastor, my doctor. We got to teach kids when the situation happens, not if, but when they are asked to have sex and they don't want to, when they're asked to get in the car when somebody's been drinking and they don't want to, when they're asked to stay the night and they don't want to, when they're offered a vape and they don't want to. We have to teach our kids what to do in that situation. How can you get out of it? The best answer I ever heard was, I tell them I'm allergic. It's like, God, that's smart. That's so smart. Because now you're not socially ostracizing yourself. You're telling your friends, I'm allergic. What friends are going to make you do something you're allergic to? That's genius. Our daughter and I had a cold. She only used it once. This was back when you still talked on the phone. If she didn't want to stay somewhere, she said, pretty please. So she called me one night. She said, so-and-so wants me to stay the night. Pretty please, let me stay. So all the friends heard her begging me. And I was like, no, absolutely not. In fact, I need to come pick you up. You gotta come home right now. That was my code. Say no. Have a code with your kids so they can get out of a situation. There are strategies. Yeah, there are strategies that we can use to help prepare our children for that. And all that does is it's training, it's teaching. Just give us an audience. And I know teachers are overworked and they got so much to cram into the curriculums, but you guys, this is vitally important. Vitally important.
I think that's like kicking kids out. It's almost just like criminalizing addiction.
Exactly.
You know, like when people get caught with a half a gram, they shouldn't be doing 3 years in jail, 2 years probation. And, you know, they should get sent to treatment and then, you know, work from there. But they get felonies behind, you know, getting caught with a pipe and some crack or whatever. It's just clearly for use.
Mhm.
You know, it's like kicking them kids out of school. It's like you sending them right out to the streets to go get some more stuff.
What happens is the kids who get out of school got a lot of free time, so they get more drugs and now they're meeting the kids at the bus stop where they're porch dropping. We're doing it wrong.
And I asked that question because I was at a recent PTSA meeting at one of our local high schools where it was stated that one of the reasons that they don't close the door to the bathroom is because the kids are vaping in there. And so they leave the bathroom door open. And this is the girls' bathroom. This is the female bathroom. They leave that door open, hoping that that will deter the kids from vaping in the bathroom. But it's a serious issue, for certain.
Yeah, absolutely. And it does happen. When I was talking with those officers, they said a lot of times the girls would congregate in the bathroom, 10 of them, and they all shared one vape. The schools that do have vape detectors, kids are wadding up paper towels and stuffing them up there, or they take a puff and they blow it down the toilet as they flush the toilet. Kids are smart. We're not going to outsmart them. We have to educate them on why it's bad and why we don't want them to do it. Because now, I mean, I had bathroom insecurity. There were bathrooms in my high school. You didn't go. I don't know if you guys did, but there were just bathrooms that everybody knew. You don't go in that one. And like Central High School in my community, there's 3 stories there. You know, and the shenanigans always takes place the furthest away. There's one school resource officer. Like, I just think we have a lot of grandmas and grandpas who want to do something during the day and help. Why don't we have them volunteer and come in and be bathroom monitors or sit and talk with the kids? Like, we have people in our community who want to connect as volunteers. Let's engage them. My gosh, you know, I learned so much from my grandma and my aunts while doing dishes after Thanksgiving. Let's have our kids connect with those community members.
Absolutely.
So there are solutions and they don't cost any money. And so we can't say we can't afford it because that's not true. It's just not true.
I think us as adults need to take more accountability and responsibility and start volunteering when we can. And you know, making our presence known. But like going up to the schools nowadays, it's like going to Fort Knox. You gotta push a button, get scanned, and you know, all of that. You know, I used to be able to go pop in and just check on my kids in the classroom. Now you can't even do that. You know?
What suggestions do you guys have? You're from this community. What can we do better for especially our kids? Heavy sighs.
And now they don't. He was celebrating his birthday. Oh, yes.
It's in the morning.
My daughter is tuned in and she's saying, like, you can tell you have to talk to people in Saginaw, the kids in Saginaw.
Yeah, we have.
That's the least of the issue.
Oh, this is
really popping.
this is more like, this is all encompassing. And I, like I said, just the 2 school systems that I've had the privilege of being invited to those meetings. But and I don't even know if those meetings occur here. I don't know if the school resource officers get together. I don't know. If they don't, they should.
With, we have, Great Lakes Bay Health in the school. Would it be possible for you to partner with them? I'm just feeling like a ball will be dropped and an opportunity missed, waiting on an invitation that may not never come.
Yeah, for sure. If you can even give us names and connect, we're pretty good at busting down doors and inviting ourselves, but there's one of me, and my role, actually, I'm a chapter developer, so what I do for F.A.N is I go into other communities and I help start chapters, just like we started here. This is just my local area, and so you can tell I have a passion. There's one of me. Thankfully, I got great partners in the community. And between me and Antonio, we have another young lady here, Heather, who's our peer recovery coach. She also heads up our quick response teams. So I might not be the person. I got a big mouth and I can bang on some doors and get stuff done, but we can pull together the right team on who could be the most effective to go into those schools. But yeah,
I think the PTSA is another avenue in as well. But yeah, definitely got to find a way to get these conversations into the school system. Very, transparent moment for me. And, I'll just be real. I've never hidden anything. The vaping thing, that's something that my son is dealing with right now. He got suspended for school for having one. And so that education is happening right now in my house. So, this conversation hits home for real. And so it has to get into the school system. We have no choice but to make it happen. And I'll tell you, as Saginaw CAP, this, we do advocacy on multiple levels. And this is yet another one that we're willing to help make happen.
and I'm certain that in Saginaw that you have a prevention network, so I'm familiar with the one in Bay where I live and the Legacy Center in Midland because I was invited to join them. I know that you have, is it Saginaw Youth Prevention Council? I think it's the one here in Saginaw. A lot of times the prevention people are the ones who work with the schools or set up if there is some training that's involved, and we should bring them in on it. That's what they get paid to do. That is their role, is prevention in the community. So that's not our primary role, but we certainly can be involved in that. But I would say we connect with Saginaw Prevention as well.
Absolutely. Do we have anybody else in the audience that has any questions or comments or anything? All right. We're hearing none. We did have something.
No.
Okay, I thought I heard somebody say something. Well, I just want to thank you all for coming. This has been incredible. I've gotten a lot of information, way more than I even expected. And so, Lori, excellent info. Antonio, thank you so much, man, for helping us set this up. We appreciate you. We appreciate your organization. If you could shout out your organization again, how anybody can get in contact with you, what resources you provide, let us know.
We're with Families Against Narcotics. You can get on our website and see everything that we do. We provide information, resources, and support for individuals and families. So we've got our Hope Not Handcuffs program. We've got peer coaches, family coaches, Stronger Together meetings. We have an in-person Stronger Together meeting that meets here in Saginaw. And we also have a lot of virtual ones. So we have virtual ones that help support grandparents because we got a lot of grandparents raising their grandkids. We have one specifically for spouses and partners because that's a different type of a thing than having a child. We have a grief support meeting that's virtual because if you've lost someone from an overdose, it's a very stigmatizing loss. So we provide grief support. We have an 18 to 35-year-old. So if you have a parent who might be struggling, like I'm a daughter of a dad who struggles with substance use disorder, or if you have a sibling who's struggling or a friend, we've got that young people's group. We just really try to find any sort of kind of gap and provide those information, resources, and support. So we help people. So like when I was in the middle of this with my daughter, I didn't even know what I was feeling because I was so overwhelmed after her overdose and her continued use. So Stronger Together helps you deal with guilt and grief, enabling control, setting healthy boundaries, what to do when the drug dealer calls and says, I'm going to come murder your kid, what to do when they call and say, I'm in jail. There's no instruction book for that. When your kid gets suspended from vaping, they don't give the parent an instruction to be like, here's how you can help your child. Like, we're just flying blind. in this world right now with all this stuff. And we need to band together and talk about who's got some ideas. We don't have all the answers, but we got some, and then you got some. Let's put our ideas together. So if you need help and if you're struggling with substance use disorder, all you have to do is call 833-202-HOPE. We answer that phone number 7 days a week from 8 in the morning till 10 o'clock at night, and we will help get you the treatment that you need, and we will compassionately assist you. And we don't just get you into treatment, we stay with you. We stay with you with a peer coach. We stay with you with anything that you need. We're here to support you. But if we can prevent this, Angelina and I want to be out of jobs. Right? That's the goal, is to put us out of work.
I'm trying to get rich like you first.
There we go. Well, I'm not twice as old as you, so be patient.
You guys have this card.
Yep, my business card's on the table over there. Yep, and I'll share some resources, and there's a couple little videos that I'm gonna have you share out. Yeah, if you could watch these 2 videos that help me understand what my daughter couldn't stop using. One is called Addiction 101. Or no, I'm sorry. What is addiction? It's this little cartoony video. It's appropriate to show to kids. I would highly recommend you show that video to your kid who is vaping. It shows how substance takes over the brain. So it's called What is Addiction? The other one is Addiction Neuroscience 101. It talks about looking at the brain MRIs when we deprive people of water, food, and ask them to talk about their drug of choice and how your brain reacts to those things. Fascinating. And it talks about the dopamine levels in your brain, how when you start using THC or even nicotine, that you start messing with those dopamine receptors, and it can be irreparable after a while. So I'm going to share those 2 video links, and then you can share that out with your mail list. But I 100% would say, watch those 2 videos that help turn this around. Because for 2.5 years, we were telling our daughter, knock it off. You're ruining your life. You're ruining our life. You were raised better than this. None of that worked. We took her phone, we took her laptop, we took her car, we took the door off her bedroom. I couldn't chain myself to her. I had a job, you know, when she was 16. But educating myself helped me do better. And then I could do better for her.
Absolutely. Jared from MDHHS, want to thank you for coming as well. From a state level, how can we connect with you and get some resources from your office?
So michigan.gov/opioids is our main site that we direct people to for understanding resources that are statewide. And again, happy to, I can share my email address. We can maybe put it in the chat here for this, and we can feel free to get a hold of me for anything else, and I can help with anything that is needed.
All right. Well, thank you so much, Nisha. Did you have any final words, or Danita, Rose?
Very enlightening. It was enlightening, and it brought tension. And anytime you bring tension, that's growth. So thank you. Did you want to get up?
Yeah, so here, I'm gonna pass this down. I got a long last name, so if I just pass the card down and type it in.
Put the 2 long Polish name people on the.
I know.
Zilkowski, my husband teases it used to be Zilkow Toboggan, so they shortened it to ski, but I was like, I don't think so.
Awesome. Well, again, thank you all for coming and sharing all the information that you have. Man, we're so thankful to have you. And hopefully we can connect with you again, because this is a conversation that has to be, it can't just be one time. We can't just talk about this one time. This has to be an educational series over and over and over again. So hopefully, we can get to a place where, we can put you and Antonio out of work.
I want to retire.
Yeah, absolutely. To my Facebook audience, our CAP community, thank you all for tuning in, and we'll see you next month.
Thanks for having us.
Thank you.
Thank you.
Keep this card.
Yep.
I can keep this card. I will just put this information on our page.
Not a problem.
So I know the meeting's like officially over, but